Hello and welcome. This is Live with Vicki and Senior Solutions. And I'm really glad that we're here today. I'm excited about learning more about Medicare because let's face it, we're getting up there in age. And even if we are already on Medicare, there's a lot that we can learn from Vicki. Thank you, Vicki, for bringing all this information to us. It's well needed. Thank you.
Well, you're welcome, and that's what I do.
It's
That's what
what
I
you
do
think about all the
all,
time.
all the time. It's just I dream about Medicare. Well, I dream about helping people, especially those who need it. That's my passion is trying to help people. I was online earlier this morning, talking to a client, and I was so pleased to know that doing AP of last year, I helped his wife and himself in getting a better plan. And they said, "We're safe." He said, I said, "I love you." He said, "I love you. We're saving like $700 a month." I went,
Yes.
"Yeah." I said, "Yes, I know. I remember your predicament." So he's happy. And I just follow up with my clients all the time about things like that. So
Well,
there.
I'm glad you mentioned that because that is important. People need to know your phone number because things change in people's lives, and there's only certain times when you can change and all that stuff. So I'm gonna tell you Vicky's phone number. I want you to write it down. I want you to put it somewhere safe because when you need it, you're going to need it. So I want you to call her at 281-849-8373. And she even accepts text on her mobile phone 713-444-3269. Because if things are changing, let's say all of a sudden they decide they're going to retire or their company's going to retire them and they're turning 65. There's a lot of questions people have. So I know that you want to be able to reach out and talk to Vicki when things crop up. Not just for you, it could be your neighbor or somebody who's taken care of. Like I had a question the other day. I was moving a lady from one personal care home to another, so we're going to have to switch doctors and all that. And so it's like, okay, what do I do about the Medicare? There's all these questions and problems that can arise, and thank goodness you're there to answer our
Yes,
questions.
I'm here. I'm here. So let's delve. Just kind of like dive right into what I wanted to talk about today. Is
Okay.
really is I'm gonna recap. Even though we're gonna go into more detail next week Medicare, but I'm just gonna do a quick overview of what Medicare is and what it is. How it's
Thank you.
put into place. So Medicare is for seniors, or I should say, people who are 65 and over, that have who are 65 and over is your health care. And so it's divided. It's not only for people 65 and over, it's also for people who have been on disability for 2 years. You're eligible for Medicare. So there are, um, you know, two different ways to get Medicare. If you're 65, you are automatically eligible for Part A. Part B, you can possibly option out if you want to, but I never recommend that. And if you are a person who's been on disability for 2 years, as well as anyone who has ESDR and the what is it? Oh shoot, it just slipped my mind. But there is another particular condition that you can get, that you might have, that you can get Medicare. It'll come to me in a minute. But so those are the eligibility requirements for Medicare, and anyone who falls in those eligibility, if you are eligible for it, you can get Medicare. And Medicare is health care for those individuals, those particular individuals.
I'm glad you mentioned that because I always wondered what they considered Medicare. It's health
Care.
insurance.
It's health. Yeah, it's basically health insurance. It's just
Okay.
it's health insurance, but is provided by the government. It's for those who are senior citizens, health care. And even if you turn 65 and are continuing to work, you still are eligible for Part A. Like I said, you can option out of Part B for the time being. You won't get penalized when you do decide to retire and get Part B, because Part B is your what everybody considers healthcare. It's basically being able to see doctors, getting tests done, and things like that. Like I said, next week we're going to go into more detail on how Medicare is basically organized. So you have four parts to Medicare. That's Part A, which is your hospitalization and skilled nursing, um, and Part B is really your preventive and uh, doctors, getting tests done, things like that. In other words, what people mostly think about when you talking about healthcare. That's in your Part B. Part C is actually what's called Medicare Advantage Plan, and we are going to talk about that a little more today. And then Part D is your prescription medication, how you receive your prescription medication once you are a Medicare beneficiary. Okay, so there's four parts of Medicare. A, hospitalization, which basically, I tell people, I always say, if you go into the hospital or when you leave the hospital, Part A covers you. In other words, when you leave the hospital and you have to go to skilled nursing or something like that, that's covered under Part A. If you leave the hospital and you're basically going into hospice, that's covered under Part A. If you go into the hospital, it's covered under Part A. Okay. Part B is all your preventive and maintenance health care, and it's there. It does come with a premium, and but the premium is lower than most healthcare, so it's a good deal. But
So you have to pay that
yes,
premium
yes, Part
on
A
Part B.
on Part B only. You do not pay. In other words, since Part B is just like insurance, okay, you're paying a premium for it. Basically, you pay it through Social Security, or you can write them a check. But it's better they just deduct it from your Social Security check if you um, decide that you're going to sign up for Part B that way. And like I said, we'll go into more detail next week on how Medicare is basically implemented, all the different parts and how it all works together. But yes, there is a premium and there are deductibles, there are copays and everything like that with Part B. All right. Part A, you have deductibles, things like that, but you don't pay a premium for it.
Okay.
If you qualify for if you're eligible for Medicare, Part A you receive and there's no premium. Okay.
Okay.
Part C is a combination of A, B, and sometimes D. I always say sometimes D together because Part C is really Medicare administered by health insurance companies. Okay, so if you've been on insurance before, then you're very familiar with Part C because Part C is just, I always call it privatized Medicare, in that insurance companies um, administer your health care. Okay, and then Part D is the prescription drug piece of Medicare. So there, depending on how you receive Medicare, you will have either your original Medicare card and your Part D card, or Part D piece. So you'll have A, B, and D, and so you'll use those two to receive your health care. That's considered option one, where you use an original Medicare and then Part D. And then there's option two, which is Medicare Advantage Plans, Part C, that you receive your Medicare. Okay, so there's two different options you can receive Medicare. One is through having original Medicare, the red, white, and blue card, Parts A and Part B, and then you get the Part D uh, prescription card. And then the other side is actually going with Part C, which is your Medicare Advantage plan, which many of them have Part D already included. So you only use your healthcare card from whatever insurance company you sign up with for Part C. So it can be a little confusing sometimes. People get confused because there's supplements and things like that. But like I said, we'll go over all that next week in a little bit more detail. But I wanted to at least give you kind of an overview of it. You have Part A, B, C, and D. You have two options as far as how you receive your Medicare, either through original Medicare, Parts A and B, and then you add on Part D to it. That's one side of the fence. And then on the other side of the fence, you can basically get through your health care through a Medicare Advantage plan, which is Parts A, Part B, and Part D included in that. Okay, but you can't do both. You can only do one or the other. So you can't add Part C to original Medicare. In other words, you're going to do either or, that type of thing. So Part C stands alone by itself, and then you have original Medicare with Part A and Part B and Part D that you have to get individually. Okay.
So if somebody comes to you and say that they're about to turn 65, you would look over their situation and
Yes.
guide them on the best plan to go to.
Right. Well, what I do when I sit down with anyone who's just turning 65 or someone who's just eligible for Medicare, I do an assessment. We go over what your needs are, what you prefer, but I explain and go into detail, what their options are, how Medicare works, how it all fits together. We sit down, we have a session, and I can either do it via the internet or I can do it face to face. It doesn't really depends considering the situation we're in. We can do it online as well or over the phone. And you can either do it by email. There we have options. If you don't want to do it face to face, but I sit down, I go through it in detail, just like I would do. I will do next week. Explaining how it all fits together, what each part is, how it's administered, because there are a lot of rules and regulations that go with Part A, Part B, C, and D. Okay, and I'm not going over that now. We'd be here forever. So I'm not going to go through all the regulations and how you have to get it, when you have to get it, and things like that, because there are timelines on when you can sign up and all that. We're not going to talk about that today. We're just giving a highlighted overview of how Medicare is. Okay,
Okay.
how it's set up. So, and that's pretty much the summary. And like I said, the next thing is talking about how you receive it. You can either get it through the original way, original Medicare A and B, and that's you. When you become eligible for Medicare, you get a red, white, and blue card, and it has Part A and Part B on there, and your effective date on it. Okay, so and then you have a specialized Medicare ID number that also comes with the card. One
And that
thing
is no longer your social security number.
that's no longer your social security is special, just for you. It's very
Finally.
unique just for you. It's unique for you, for the individual. And I would say is keep that secure just like you would do your social security number, because it's still, even though social security number is not on your Medicare ID card anymore, your Medicare ID number is still something that people can take advantage of if they have it. Okay, there's fraud, waste, and abuse out there all the time. So
Okay.
you still keep that very secure. Now, the next thing I want to go into is what Medicare does not cover. Okay.
Oh, that's very important.
Yes. Yes. A lot of people think Medicare covers everything, and it does not.
Well, we hope it covers everything. Let's put it that we can always hope, right?
Yeah, I can always hope, but it doesn't cover everything. Like
Darn.
a lot
Okay.
of things, people think dental and vision is included in Medicare. Not so. Okay, you have to get dental and vision coverage outside of Medicare. So if you choose to go the original option one, original Medicare route, then you would have to add on a vision or dental policy to your Medicare. Many
Got it.
of many, if you go option two with the Medicare Advantage plan, many of the dental and vision benefits are included in some of the plans. I'm not saying they're in all of them, but they are in some of the plans. So, so dental and vision is not included. Long-term care is not included in Medicare. Many people think that it is, but it is not. Okay, you would have to get long-term care. Either there are long-term care insurance policies out there, um, uh, but if you want to plan for your future, you want to get a long-term care plan, because as we get older, we know there will come a point where we're going to need assistance. For, I would say, majority of us, we will need assistance when we get into our 80s and 90s. And that's just the way of life. So we need to plan ahead, and even if we're not sickly or anything like that, it's good to have a long-term care policy. So the best time to get that type of coverage is really in your 40s or 50s because it's a lot less costly. As we get older, of course, it will be more expensive because that's just how insurance works. Insurance, they take into factor risk factors, and as we get older, unfortunately, we are considered higher risk when it comes to coverage. But
Time is ticking. Time is
yes,
ticking. You need to get your insurance now while you're still young.
yes. So, but long-term care is not covered under Medicare, and if people don't understand what long-term care is, that's when um, you are you can get into a skilled nursing facility, or if you need to um, be your living situation needs to be in a skilled nursing facility, or even skilled nursing facility. Just stay with that because sometimes institutional type of living situations you might have to go that direction as well. Most people look at them as nursing homes. So um, if you fall in, if that happens to you as you get older, um, getting having to pay that expense because Medicare doesn't cover it, having to pay that expense can be really tough on your retirement. Because now at that time you're not working, you're not getting any extra income.
Right. It could break you.
Yeah, it could break you. You're on a fixed income, so uh, those type of things you need to take in consideration when you're retiring, even when you're setting up, getting ready to retire. Uh, Make sure you have sat down with someone and gone over your healthcare situation and what you need to plan for down the line. Have it all in place because so many people get to a point, they just, it's not one of those things that they think about, but when it happens, you're like, uh-oh, what am I going to do? How can I survive? I need help. I need somebody to, take care of me. And if you don't have family, and, whether it's your children or, whatever, you could be in a bad situation. Many people have lost their homes, because they did not have the right plan in place, or they didn't plan ahead. I just put it like that. They didn't plan.
Right. And so what you're trying to tell us is there's certain things that Medicare does not cover. And if you don't think about those things, it could really hurt you. It could
Yeah.
bite you in the rear end if you're not careful. So
Yes.
that's another thing that you go over with people when they set up an appointment with you is what's covered, what's not covered. And I know that everybody's situation is so totally different. Like I have my friend who's got Alzheimer's who's living in a personal care home. That's not covered by Medicare.
No, it's not. That's considered those type of situations. That's why I say are considered long-term care.
Yep,
That's
she has to
long-term
pay
care.
that out of her own pocket
Yeah, that's
or have insurance. Yeah.
yes, yeah. That's considered long-term care. And long-term care policies vary as well. Depending on what you want to set yourself up with. You can get a long-term care policy that will cover someone coming into your home. So if you want to stay in the home that you have, you can get a long-term policy that basically will cover that. That
Now,
will
do you handle those long-term care policies as well as the Medicare insurance?
Yes. Basically I am a full-fledged insurance agent in the state of Texas as well as other states outside of Texas. So I handle anything that has to do with insurance. Pretty much that's me. But I specialize in the senior market. I specialize in the senior market. So I specialize in Medicare, healthcare. I specialize in long-term care because it's in the senior market. I do dental, vision, as well as life. When people are planning for final expense, a lot of people might have a life insurance policy, but it's good to have a policy that's just set up for your final expenses. In other words, just for your funeral or whatever. It's good to have that separate than just a big life insurance policy because those policies are set up to cover those type of funeral type of expenses, where it's not a big sum, and so basically you can hand that over to the funeral home, your I should say your whoever is your or your beneficiaries, can basically hand it over to the funeral home, and they take care of that vice, handing them over a big, huge policy, and that huge policy where the beneficiaries could be, getting it to take care of other things, or debt or anything else. Now the funeral home has it, and they're holding on to it until they get their money out of it. The other advantage of having a final expense policy only is that um, you can basically, when you're working with a funeral home, you know what your budget is, you know what your amount is, and so they, you can work within whatever the final expense policy is by saying, oh, I have this big, $100,000, $200,000 policy, and then they say, oh well, we can give you, we can set up a funeral for your loved one for so much money, whatever. So it's just an option. I'm not saying you have to do it that way. It's just an option. So anyway, but back to, I know I just jumped out of the subject matter or whatever, but that's just a side note. I do all those things. Yes, thank you for bringing that up. So I handle pretty much life, dental, supplemental insurance, as well as Medicare.
Well, it's good to know, because then you don't have to pay for this insurance over here and this insurance over there. You cover it all, so you know exactly what every person that's coming to you to get advice, you know what to do and how to get them the best price for their
Yes,
insurance.
yes, and also the thing is the other thing about it is, and the reason I cover everything is that, and or got into this, is that you don't have to go and try to find different agents. In other words, I'm an agent that covers you. In other words, I'm gonna protect you. Now, I'm not gonna protect your house, okay?
Or
I'm
my
not,
car.
or your car, So I protect you. In other words, I basically sit down with you to protect you, and not, uh, physical things, but you as a person. Okay. So, but no, but I can't. I do have, colleagues that do cover health, and I mean, uh, car and homes. So we kind of work together. So if someone needs that type of insurance, I'm gonna always pass it on to them. So I work that way, and I've done that a lot for my clients. I don't cover that, but I just refer them to some of my
Sure, right,
colleagues.
right. Somebody you already know, not
Yes.
some jerk off the street that could rip you off.
So that's the thing. So we covered long-term care, as far as how that's not covered by Medicare. We've
Right,
covered dental and vision. That's
right.
not covered by Medicare. Other things are not covered by Medicare, and a lot of insurance companies, regular insurance companies, don't do that either. It's cosmetic type of surgeries, whether it's necessary or not. Medicare doesn't cover cosmetic surgeries, acupuncture. Let's see what else. It's a list of things. Well, those are the highlights of what Medicare doesn't cover. Hearing aids and exams, unless they are, uh, when it comes, they'll do a screening, but hearing aids are not covered under Medicare either. So you'd have to do that on your own. Now, a lot of the Medicare Advantage plans are now covering those type of benefits. So will include acupuncture and hearing aid. They'll have a hearing aid benefit in them. So if that's something you think you need, and because hearing aids can be expensive, okay, per ear, they can be expensive. A hearing aid, uh, for one ear can run between $3,000 to $5,000. So it can be very expensive. So if that's something that, and you might need, or that you're losing your hearing, maybe a Medicare Advantage plan might be beneficial for you. It just really depends on what your needs. And like I said, when I sit down with you, with a person, I go over those things. It's like, if you are in need of dental, many people kind of say, I need some dental insurance. So I can, we'll go over all that, as far as what your needs. Like I said, I do a needs assessment, and we discuss what your needs, what you're looking for as far as healthcare and covering you. You know, so I do that. But hearing aids are not covered. Um, Acupuncture is not covered, and cosmetic surgeries are not covered under Medicare.
What about the COVID issues that we're having, is that covered? Like
Yes,
if you want to go get tested
yes, that's
and
covered under Medicare. Medicare actually covers a lot of different testings that you would that you wouldn't think would be covered. And there's a listing on Medicare.gov that says what tests are covered and what tests are not. But COVID is covered under Medicare, whether you have a Medicare Advantage plan or whether or not you are on original Medicare. COVID is covered. Now, the other thing I wanted to talk about is bridging the gap. A lot of people, when you get a either option one going original Medicare or Medicare Advantage plan, there are going to be times that the cost of a procedure or cost of something is going to be expensive, or it's going to be a little bit more than you really have in your budget to do on the spot. So that's when supplements come into play. And there are different types of supplements. There are supplements that go hand in hand. They're called Medigap plans or Medicare supplements that go hand in hand with original Medicare. Okay. So if you have option one, original Medicare, where you're doing the original card, your A and B card plus D, you can add a Medicare Gap or Medicare supplement to that option, and they run. Depends on what you're looking for, but there are plans like A through O. Uh, well, actually, O is not long available, but they will cover the things that the some of the cost sharing that Medicare will have, that might be a little bit too expensive for you. Like when with original Medicare, you have to meet your deductible to go in the hospital. Well, with a supplement, your that deductible is met. Okay. Um, if you have copays, there depending on the supplement you have, that that cost share is met through Medicare supplements. Okay, and they're called Medicare supplements or Medigap. The Medigap plan because they bridge the gap as far as your cost sharing with Medicare. So say you have to go in the hospital, the deductible for go with original Medicare to go if you have to go in the hospital, it's like $1,300 plus. That's a deductible. Well, with a Medigap plan, well, depending on the plan, it will cover that deductible. The one that most people get is the Plan G, which covers majority of your cost sharing with the original Medicare, except for the Part B deductible. But it will cover both Part A and Part B cost sharing if you choose option one with original Medicare. Now, on the other side, with option two, um, there are also plans that will help in the cost of hospitalization, and they're called hospital indemnity plans, or now they have kind of a tag name, Medicare Advantage Gap plans. Okay, they're like bridging the gap, and so you can get hospital indemnity plans to cover the.
my goodness, how do you keep all this straight?
You ask me. That's what I'm here for.
Exactly my point. I don't want to keep all this knowledge in here. So no matter what my situation is, you're going to be able to help me sort it out.
Yes, yes. So
Yeah.
with the hospital, with the what they call Medicare Advantage Gap plans, it covers not only hospital copays, but some of them will cover your copays to see doctors. If you have to go see a specialist all the time, there are certain plans that will cover those type of expenses as well. So
Right.
there is supplemental insurance out there to cover an expense. The biggest thing to do is call me or someone that knows all that and basically can get you the coverage you need, so you're not coming out of your pocket for expenses you didn't expect to have to pay.
I know that we've run out of time and you've got so much more to cover. I want you to know that we're here live every single week, every Tuesday at 1 o'clock Central Time. And if you have questions you want to ask Vicki live right here on the show, there is a comment box. We'd be happy to talk to you right here on the show. If you want to contact Vicki later and ask her some questions, maybe set up an appointment so that she can talk to you on Zoom, just give her a call, 281-849-8373. Or you can text her or call her on her mobile phone, which is 713-444-3269. I want you to feel free to reach out to Vicki because she wants to help you. And I can tell you, I've known her for many, many years. She's really about helping and keeping you healthy. Thank you for joining us today. Any last words for our audience today?
Just be safe. Stay safe. Think about some of the things I talked about in the past. Health, being taking care of yourself and being healthy. That's the important thing. So do all the things that you need to do to stay healthy.
Thank you. And we'll see you again next week. Bye for now.
Bye-bye.